I just caught a distressing call from a patient, had tick exposure, has all of the classic signs and symptoms of Lyme disease. We did a workup, we were able to identify different versions of the life cycle. We ordered a Lyme test that came back with 3 positive bands. Now, the CDC criteria is 5 positive bands. I say, like, if you had positive bands, especially, 3, 4, I believe that you've been exposed and the disease is a factor for you. She went in and told her family practice doctor, who said, I don't believe in Lyme disease. And the patient said, look, I'm so, distressed. I fit all of the symptoms. I've read, I've researched about this. They did years of study before they came to me to ask if they had it. And she says, what am I supposed to do with my doctor relationships? He didn't listen to me. He didn't even give me a chance to explain. He said, I don't believe in it. And I said to her, well, it's not like it's a religion. Here's what it is based upon the guidelines. The diagnosis is Lyme exposure, which she had, tick exposure, what she had. She had so many of the different symptoms: muscle aches, joint pain, hormone imbalances, heart fluttering was one. And then the joint pain would go from ankle to the knee and the knee to the shoulder. It was migrating, moving all around, which is one of the classic signs. And I said, well, maybe it's time for you to get a open-minded or a doctor that's willing to continue to study after they get out of school. So I hear this a lot with doctors saying, look, Lyme disease only exists in Connecticut. It only exists in Missouri or Wisconsin. It doesn't exist in Arizona. It doesn't exist in Idaho. And what I tell people is, well, have you traveled to those places? And have you been in the environment when you can be exposed to the vector or the tick? It's kind of head scratching to me at least not to listen to the patient and be able to be like, hey, wait a minute. Maybe this is a consideration. Maybe or at least get educated on it. When you close off and say, this is not possible to happen, maybe it's the wrong healthcare provider for you. That's my thoughts on when doctors say, I don't believe in Lyme disease. We'll see you guys on the next video.